Social media and mental health, the connection between the two making headlines, with the leaders of big social media companies even testifying before Congress. Joining us this morning to talk about the mental health impacts is Dr. Jennifer Shields, clinical psychologist and assistant professor at OU Health Sciences Center. Doctor, good morning and thanks for joining us.
Good morning. Thanks for having me.
Of course. So let's get straight to it. Can you talk to us a little bit about the correlation between social media and the impact on mental health?
Absolutely. So the research in this area is really new and it's continuing to grow. Even as early as the last year, research has been coming out summarizing what we know about social media and really its potential to aggravate mental health impacts. What we know is social media is incredibly compelling. It really triggers that reward system of our brain, and anytime we're spending a lot of time in sedentary behavior or we're comparing ourselves to others, this can have a role in impacting things like depression and anxiety.
So definitely something to look out for here. So what are the signs that someone's mental health is suffering?
Yeah. So when we work with kids, we want to just think about this in the context of their overall health. What does a kid look like when they're healthy and doing well? They're doing things like eating well and sleeping well. They're able to focus at school and form positive relationships with other people. And so if we start to notice that kids are having difficulties with those types of things, that's really when we start to go, maybe we've got a problem here. And it's a good time to talk with their pediatrician.
As we continue talking about the use of social media, what are some of the causes of unhealthy social media use?
Yeah, so I think when we start to have these conversations, it's really easy to become one-sided on these types of issues and view it solely as social media is a good thing or a really negative thing. And the answer is it's somewhere in between. But kids are in a vulnerable period of identity development. And so they can have trouble self-regulating about how much time they should be spending on social media, what types of content they should be consuming. And so when they see certain types of images, this can really prompt, image concerns, especially amongst young girls. And we may see that kids are turning to social media looking for support, but in fact, they end up feeling more socially isolated after spending that time.
And so this is just really creating a lot of headlines here. We've seen the CEOs, presidents of these big social media companies just yesterday, Instagram CEO testifying before Congress. Do you believe that social media companies are doing enough to protect their younger users?
Yeah, this is such a relevant question and a complicated question. Certainly, social media companies have an obligation to ensure they're establishing appropriate protections to make sure our kids aren't experiencing harm. And I definitely think it's important that they continue to engage in research to understand this and how they can protect our kids. But what I think people are saying when they ask this question is really, I'm worried. I'm worried about my kids. I hear reports in the media about social media challenges and bullying, and all of this seems to be getting worse. And how are we going to make sure our kids stay safe? And while simple answers are appealing, they're not always the most accurate. And I really think that the only response that's going to truly address this issue is one of us all coming together. So that means tech companies, that means parents, that means experts in mental health and child development coming together to make sure we're thinking creatively and considering all perspectives in order to keep kids safe on social media.
And speaking of that, any advice for parents on little things that they can do to help protect their kids?
Yeah, we as parents really do have an obligation and a duty, but also this tremendous opportunity to support our kids in their development. So I would say that parents need to be aware of what types of content their kids are consuming. Supervision is really important, and the type of content that will be appropriate for kids to engage with and the level of supervision they require is going to change over time as they age. But certainly your role as a parent and that support you provide them will remain consistent throughout their lives. And since kids are in this period of identity development, it's important to talk with them about their social media use. asking them questions like, what value does your social media represent? Kids may not always be aware of things like kind of the highlight reel effect, or the fact that people are using filters to put their best foot forward and promote themselves. And so to them, that seems real, and it sets them up for comparison. So talking with your kids about their usage and coming from a place of genuine interest, not just of concern, but interest and wanting to be engaged in their lives. If you notice as a parent that your kid seems to be struggling with social media use, it's good to encourage them to take a break from it, and help to promote other types of pro-social activities.
Really good tips there. And Doctor, teens and kids, we know, aren't the only ones on social media. Some adults also spend a lot of time scrolling. I'm guilty of it. Are adult users seeing the same negative impacts?
Yeah, I would say absolutely. And especially in the last 2 years with COVID and the pandemic and social distancing, I think we're all craving social connection. And that's not a bad thing. But social media does seem to, from the research, be a potential risk factor for those that are already struggling with their mental health. So for us as adults, if we notice that we're starting to feel worse after we're spending time on social media, it's our job to be our own advocate, our own parent in our lives. We set the rules for ourselves and how we use social media, and we should choose to engage with content that leaves us feeling better about ourselves and better about our world. And if that's not happening, it's time to set some limits on it.
Dr. Jennifer Shields, we appreciate your time and your expertise. Thank you for joining us this morning.
Absolutely. Thanks so much.
And we will be right back after this quick break.